For high-risk groups, those who were born before 1984, because there's a 15 to 20% prevalence, be sure to check if you have been screened to make sure you're not a carrier of hepatitis B. Hello everyone, I'm Dr. Liu Yuzhi. Let's welcome Dr. Chia-Yen to join the Care Online. Hello everyone, I'm Dr. Chia-Yen. I currently work as a visiting staff in the Division of Hepatobiliary and Pancreatic Medicine at Kaohsiung Medical University Zhonghe Memorial Hospital. What are the symptoms of acute hepatitis B? So-called hepatitis B is caused by infection with hepatitis B virus. Once first infected, it is called acute hepatitis B. You can understand that hepatitis may have physical symptoms, which can be roughly divided into three types. After acute hepatitis B, first type is asymptomatic. This is a majority. Most people with acute hepatitis B have no symptoms at all, and they don't even know that they have had hepatitis B. The second type is those with mild symptoms. Generally, acute hepatitis B may be the same as other hepatitis, and you will feel tiredness, easy fatigue. You may have gastrointestinal problems, such as nausea and vomiting. More severe cases will have dark brown urine or jaundice, etc. After these symptoms pass, we recover completely. The third type is more troublesome. If liver function decompensation occurs, severe jaundice, ascites, hepatic coma, and even death will occur. This is fulminant hepatic failure. Fortunately, this kind of patients only account for a small part. In conclusion, hepatitis simply divided into symptomatic and asymptomatic. In symptomatic patients, we can further divide them into mild or moderate severe clinical presentation. You need to receive a series of examinations to confirm the diagnosis and the severity of hepatitis B. What are the symptoms of chronic hepatitis B? Chronic hepatitis B means the infection persists for at least 6 months without elimination. We call it chronic hepatitis B, and it is generally referred to simply as a virus carrier status. It is a worrying situation that most patients actually have no symptoms because the liver does not have innervation. Even if it is severely inflamed or otherwise, it may not be painful. Therefore, most of patients with chronic hepatitis B are asymptomatic, which is the biggest problem at present. Some patients will develop more serious conditions due to chronic hepatitis B. Symptoms of hepatitis may occur. They are prone to fatigue and possible digestive problems, such as nausea and vomiting. But these are not many. For more severe symptoms, jaundice, ascites, encephalopathy, or hepatic coma will also occur. Symptoms of chronic hepatitis B are diverse, but I want to mention again that most of them are asymptomatic. Therefore, we may neglect to pay attention to it and check it. From our perspective, patients with chronic hepatitis B must be properly diagnosed and follow up afterward. Never base on the symptoms to decide whether to seek medical treatment. The three most important things in the prevention and treatment of hepatitis are prevention and then treatment, and next step is the follow-up. The situation of chronic hepatitis B, when time goes by, will become a trilogy: liver cirrhosis and then liver cancer. Many chronic hepatitis B patients develop liver cirrhosis once they have symptoms, even liver cancer. In other words, it's in a relatively severe disease stage. Therefore, we especially appeal to patients with chronic hepatitis B. Because they have no symptoms, they should pay more attention to regularly follow up for this part. What is the prevalence rate of hepatitis B in Taiwan? The prevalence of hepatitis B refers to the rate of surface antigen carrier. If the blood test shows positive of HBV surface antigen, you are diagnosed of hepatitis B infection. The past Taiwanese epidemiology research revealed that in Taiwan, Penghu, Jinmen, Mazu, Orchid Island, Green Island, and Great Sun Island are all the same. Generally, 15 to 20% of adults are carriers of hepatitis B. In other words, 1 out of 6 or 7 people walking on the street is a carrier of chronic hepatitis B. Its prevalence rate is about 15 to 20%. But this epidemiology has changed a lot. since newborns started to be vaccinated against hepatitis B since 1984 in Taiwan. In fact, Taiwan is the first country in the world to launch a universal hepatitis B vaccination program. This achievement is very remarkable. After a complete vaccination, the HBV prevalence rate among the adults born after 1984 already dropped to less than 1%. From 15 to 20% in the past to less than 1% nowadays, this is a very important progress. It is also a very positive outcome in the aspect of preventive medicine in Taiwan. This is a well-known accomplishment in the world. As for the high-risk group, those born before 1984, there is a higher prevalence rate of 15 to 20%. We must pay attention to whether this group have undergone surveillance to make sure that they are not hepatitis B carrier. A small number of children still have this disease. If necessary, they still need to be screened. This is the update of hepatitis B situation in Taiwan. I remember that she was a senior manager. She would take a health examination provided by her company. She also had follow-up at my clinic initially. Later on, she was busy, or the company was not here for physical examinations for 1 year, so she neglected the examinations. After 2 years, liver cancer developed. Because the tumor was relatively large, it is untreatable. Now she had passed away. We still advise to all patients with chronic hepatitis B that regular follow-up is important. You cannot wait for physical discomforts then see a doctor. Be sure to maintain regular follow-up to ensure your health. Thank you, Dr. Chia-Yen, coming to the Care Online. See you next time.